Thank you very much. My name is Dr. Jane Morgan. I represent Piedmont Healthcare. And one of the things that we've seen within our healthcare system is the average length of stay vary between these variants. And so when we look at this ancestral strain that originally became 2 years ago, average length of stay in the hospital was 8 days. At the next surge, our average length of stay decreased to 7.1 days. With the third surge, 7.4 days, and then peaked with Delta, average length of stay in the hospital at 8.5 days. What we see now with Omicron is a drastic reduction in the average length of stay in the hospital of 5.8 days. And that is in recognition of the decreased severity of this particular variant. But we should not take this lightly and in fact reject the narrative that this is a variant that we should minimize. If it were not for the decreased severity of this variant, because of its increased transmissibility and the increased absenteeism that we are experiencing with our physicians and other healthcare workers, we surely would have overrun and overwhelmed our healthcare system. One of the things that I am asked frequently, Dr. Morgan, I am exhausted. I am tired. I am anxious. I am concerned about my children. I'm not sure what to do. We tend to see the landscape and the data continue to change and the recommendations. Shouldn't I just go ahead and intentionally get COVID and get it over with, especially with this particular variant that seems to be less severe? And here is why that is not a great idea. We see with Omicron so many mutations on this spike protein until it has negated 2/3 of our medical therapeutics of monoclonal antibodies. We now only have one therapy that is effective against Omicron. That has created a supply shortage. We also see with our anti-COVID pills, the Paxlovid and Molnupiravir, that we also have supply issues. And so if you present to the emergency room and to the hospital, physicians, unfortunately, are in the position of having to triage care, which is demoralizing to all doctors. We are all trained to treat and save everyone. But if we are in a situation where supply is not available, we now have a variant that has challenged our medical therapeutics such that all of them are not available. And also new therapeutics have not become accessible, then we are in a position of triage, which is not a great position to be in. The other thing to think about, if you are thinking of going out and getting this particular variant anyway, is long haul syndrome continues to be very prevalent. And not only is it prevalent, we still have no treatment for it. We have no way to identify who will move on to these long haul symptoms, and we have no way of preventing it. And this crosses all types of demographics. And so even though your initial infection may be mild, the irony is you may find yourself much sicker down the road with cardiac palpitations, shortness of breath with climbing stairs, memory fog, difficulty with memory that may lead to disability or difficulty on your job and in school. The other thing to think about is our children. As scarce as these therapeutics are for our adult population, these therapeutics are not authorized for children. And so they do not even have the option of having them available. And so why would we risk this population that has no opportunity for all of these new therapeutics that are coming about? We also must be concerned with millions of people being infected throughout the world, that each infection represents an opportunity for this virus to replicate, to mutate, and to create yet another variant. We do not want to continue to contribute to these infections by having intentional infections. And so when you add all of these things together, that we have a decreased effectiveness of our monoclonal antibody supply, that we have an access issue with our anti-COVID pills, that we have staffing issues with physicians and nurses being out of work because of positivity, that we run the risk of variants developing beyond Omicron. This is a terrible idea. This is a terrible time to be considering a strategy such as this. You could be the one who presents to a medical facility, and we are having to triage care because of supply and demand. This is an absolutely terrible idea. The other question that I often get, Dr. Morgan, is with regard to quarantine and isolation. And what I want to emphasize is that I have seen time and again people travel even though they are symptomatic. And the justification is that they did not have a COVID test that was positive. And so they wait until they get home and then they test. The test is positive, and at that time they begin their isolation. But the fact of the matter was, their symptoms began before they began to travel. They chose not to test such that they would not have that information. And so what we need to emphasize is that a lack of a test does not equate to a lack of infectivity. Just because you either do not test or maybe you don't have access to the test doesn't mean that you don't have COVID. And in fact, if you have symptoms that are similar to a cold and similar to a flu in the middle of this particular variant that is the most highly transmissible and contagious that we have seen to date, then you must assume that you are COVID positive and make certain that you take every precaution to protect yourself, to protect your family, to protect all of those around you. We want to make certain that people understand that vaccines are available. We still see this trend, not only at Piedmont, but in other hospitals throughout the state, throughout the United States, and throughout the world, that the majority of people who are hospitalized and who are in the ICU remain the unvaccinated. And so even though our vaccines are under challenge, they have been a success. Even though Omicron has been able to evade some of our vaccine properties and block transmission abilities, these vaccines have still kept us by and large out of the hospital and certainly out of the morgue. And so we want to continue to make certain that people understand the value of these vaccines and that we also understand the importance of public health measures, wearing a secure and tight-fitting N95, KN95 mask. We want medical grade masks, social distancing, washing your hands, utilizing home tests, such that you can mitigate your behavior and control your environment in as much as possible. And lastly, we would like for everyone to remember that we are all in this together. This is not a singular disease. Your decision does not only impact you, it is a plural disease. Any decision that you make has the potential to impact hundreds and thousands of people around the world. If you need any indication of that, look at Omicron, first identified in South Africa on November 24th. Here we are on January 20th, still battling it in the United States. This is a plural disease and not singular. And so we absolutely want everyone to please practice kindness and consideration for one another. Thank you.